Hello and welcome to our virtual event. This is Aaron Goldberg, contributing editor for IDG, and I'll be with you as the moderator on today's webinar. Healthcare is always a hot-button topic among the general population, especially since the technology surrounding the provision of services and healthcare plans is changing rapidly. A major focus of this change is to treat members and patients like customers, and customers expect their healthcare experiences to be similar to an experience like they may have with Amazon. Very customer-focused, transparent, and easy to do business with. While digital transformation is taking over almost every industry, healthcare has been lagging behind other industries in implementing these technologies and charting a digital transformation path to better engage consumers. Fortunately, there are some new solutions coming to market that will ease the transition for healthcare organizations. Today, we'll look at some of these and the overall strategy for moving much more quickly to digital healthcare. To answer key questions and provide deep expertise, we have two great speakers with us today. Kate McCarthy is a senior analyst, digital business strategy for healthcare at Forrester, and Andy Ahrens is managing principal, healthcare plan innovation and consulting. Let's get the event started and move forward.
Thanks for that introduction, Aaron. We've got three topics we're going to cover today. Our guest, Kate McCarthy from Forrester, is going to cover the state of the consumer experience and engagement in the health plan market, and opportunities for health plans to cultivate greater consumer loyalty with the quality of customer experience. At the end, I'll come back with a little bit of a preview on a study that we've done on the friction that health plans put in the way of their customers when they're doing their Medicare Advantage enrollment, where we looked at the Medicare Advantage enrollment experience with over 50 health plans to gauge how well they do. With that, I'll turn it over to Kate.
Thanks so much. I'm excited to be with you all today and really looking forward to talking to you about what Amazon is going to do in healthcare to help push us forward. But I first want to ground everyone in a couple of big ideas. First, let's just reflect for a moment on the state of customer experience in healthcare today. I think we can all agree that it looks a lot like this. It is fragmented, it is messy, it is hard to navigate, and full of friction. And when we talk about great customer experience in other industries, we give a nod to what we call frictionless experiences. And in healthcare, we have quite a ways to go before we can start delivering the sort of customer experience we've grown used to in other parts of our lives in other industries. The first thing we need to do as organizations in the space is take a step back and recognize that our patients and our members, our referring providers, our referring organizations, all of those constituents are customers. And we have to become obsessed with their experience. We know that great companies differentiate around customer experience and that great customer experience drives revenue. And so taking that moment to take a step back and really ground yourself in the idea that the people we serve, regardless of where they interact with us, they're customers, and take that customer experience mindset in everything we do becomes really critically important as we try to digitally transform in this space. When we talk about customer experience quality at Forrester, we talk about three key areas. The first is effectiveness. This roughly equates to, I understand the products and services you are selling, and the experience I get from your organization delivers value to me as your customer. In healthcare, it's not always clear who we go to for what due to the fragmentation. So when I have to pay a bill or understand a bill as a consumer, is that something I go to my insurance company for, or is it something I go to the provider who sent me the bill for? What's the difference between an explanation of benefits, or EOB, and a patient bill? How do I reconcile those things? Those are things that are challenging in our space and unique that we need to solve as we move forward, just as a couple of examples. The second quality domain is ease, that once I make a decision to interact with your organization, it's not difficult for me to get value out of that relationship. So if I'm looking for an insurance product and service, it's easy for me to understand my benefit design, what my financial liabilities will be, who I can see for what services without getting surprise bills or finding out someone's out of network. All of those sorts of things fall into moments that would contribute to the ease of the experience. And then lastly, the thing that really differentiates great customer experience organizations is emotion, that customers who interact with you feel good about their experience. I think we can all admit that we've got a ways to go in healthcare before we consistently deliver on these three quality areas. But as we start to check off the different things that drive those quality measures, it becomes easier to think about what's a future healthcare organization look like and how do we get through these steps to deliver better customer experience. Thinking about how we can do this, great digital experiences that are informed by insight on who our customers are is how most organizations differentiate. We talk about customer experience as being critical, and we talk about differentiating around digital as the way we get that done. When we look at other industries, 91% of consumers make online purchases today. You can probably think about the last time you made an online purchase yourself. But when we look at healthcare, we're talking about less than 40% of our consumers engaging digitally. We still rely on analog, telephone, paper, face-to-face for the majority of what we do. And I think if you're like me, some days you feel like this. And it gets difficult to think about how do we move from where we are today to a digital future. But our future will be digital. And with digital transformation will come conservatively a $300 million savings tag. We know healthcare in the U.S. is particularly unaffordable. And as we look at digital transformation of the other industries, one of the things that happens through that process is that the cost across few consumers is very high before digital transformation, and then the cost after digital transformation is less across many consumers. We expect the same thing to be true in healthcare. And thinking about what great digital experiences would look like, there are a few examples out there already today. And, while we were sort of fumbling with limiting systems of record, the medical records, the claim systems, things that are clunky that we need to drive our business, other organizations have gone off and built really incredible experiences. The first is an example from Dexcom. They built a continuous glucose monitor, which allows diabetics to see on a continuous basis what their glucose results are, and that allows them to more effectively manage insulin replacement in a 24/7 modality instead of relying on test strips and potentially missing moments of being high or low in their insulin replacement. The reason I like to show this example is that it's not just cool technology that makes it easier for these patients to manage their chronic disease in a better, more effective, and more cost-effective way. It's a great digital experience. You can see that it's very simple as far as the UI goes. Easy to see what the number is. If I'm a juvenile diabetic, if I'm a kid, it's not too complicated for a child to read. This also allows those children to connect the app experience to their available caregivers, so mom and dad or someone of that nature. And so people who used to have to rely on being physically present can now get alerts on their mobile devices regardless of where in the world they are, so that they can be available and helpful. But it's a great user experience. It is easy to read. It is easy to react to. There are audible alerts that go with it. And the thing I like best about it is that one of the things we talk about that differentiates great digital experiences is that they're highly personalized. This is highly personalized, but it doesn't expose any patient data. It is just the glucose value. And that, I think, is one of the things that is a struggle for a lot of organizations to think about. How do we create a great digital experience in a way that's HIPAA compliant? Well, this is a great example for you. Think about what's a good user interface. And then think about how you transform the way that you do something today with something digital. We have long relied on being highly personalized in the way that we communicate with patients. We can still do that without exposing PHI, and this is a great example of that. Another great example is the Apple Watch. The smartwatch space with more advanced heart rate monitoring is allowing us to think about, what are the non-FDA approved devices that we can use to help manage diseases and instill health and wellness in our consumers. Again, continuous heart rate monitoring is a very, very simple thing to read, easy to react to, easy to know, based on the alerts that you get from your watch if you need an intervention, but doesn't expose any patient data. Another great example. And then lastly, and probably my favorite thing as we think about digital transformation and the new technologies out there, are the virtual assistants. If you think about what's the opportunity to connect care to the home, virtual assistants are a great avenue. There's lots of different use cases here, but the Google Home already has the ability to schedule appointments in Epic, which is one of the market-leading electronic health record vendors that is typically really difficult to integrate with, and testing has shown that they can do this in a matter of minutes. And so if I think about what it would take for me to pick up the phone, call, and schedule an appointment, that's probably 15 or 20 minutes that process would take, and now with the virtual assistant, I can do that in just a few minutes. It's pretty remarkable. And I think if you have been watching the news recently, you've probably seen that healthcare hits the headlines quite often these days. Most recently, Amazon, JP Morgan, and Warren Buffett with Berkshire Hathaway announced a potential opportunity in healthcare. In advance of that announcement, Warren Buffett actually came out and said medical costs are the tapeworm of American economic competitiveness. And this is really exciting news for the space, but it creates a competitive threat. We expect that this will be disruptive to the space. These three organizations are coming together initially to serve their employees, but they do intend to offer a public offering for managing care and cost across a consumer base. Knowing how successful Amazon has been in other markets, it's very, very likely, especially in these partnerships, that they will build something that is customer obsessed and digitally native that fundamentally shifts the way that we deliver care and manage cost in our industry. And they're not the only ones. You don't need to look far to see that really everyone is looking for a dance partner right now. There's a lot of recognition that no one's going to be able to make this shift alone, that we need to think about partnerships in new and different ways. I think, a couple years ago, all of us would have been surprised to think about someone like Aetna partnering with Apple around something like the Apple Watch. But today, this is common news. We see lots of different technology partnerships coming together between traditional healthcare organizations and companies like Apple and Fitbit and Samsung. And we see digitally native insurers like Oscar partnering with our largest Medicare Advantage plan, Humana. The industry is going through rapid consolidation and rapid realignment as organizations recognize the threat of new competition from folks like Amazon, the need to go digital, and the need to become customer obsessed in order to be successful in the future. And in 2017, we saw more mega deals over $1 billion in Q4 than in any prior year, and we expect that pace will continue. So what will the future look like? Our pharmacy's digital journey hints at what a future might look like in healthcare. If you think about incumbents in the space that have some digital presence, we have everyone from CVS to Walgreens to Express Scripts. But then there's a host of digital-first new market entrants. These are small companies. None of them are probably big enough to be disruptive on their own, but they're showing us a roadmap to doing things differently than we do them today. In digital transformation, the change is exponential, not incremental. And organizations that successfully digitally transform don't just replace what they do with digital processes, they come up with new processes. And so if we look at what some of these organizations are doing as new market entrants, PillPack takes the guesswork out of figuring out what time of day and how to take medications. If we think about what it does to organize someone who's a chronic patient on multiple meds and organize those medications by time of day, you can include vitamins with these things. So, it can really be anything that the patient's taking. And we know that medication adherence is one of the things that correlates to how well patients do in their treatment plans. But figuring out when to take what can be one of the more complicated things. Also remembering to take things and having a way to check off that I actually took the medication is one of the more difficult things. And so PillPack is a pretty simple intervention where it just organizes your pills for you and shows us that, you can eliminate guesswork just by using this technology. And we think about what IoT does as a step beyond just simple integrations to allow for that tracking of medication adherence. So did I take my pills or not? I expect, this is PillDrill. I expect that Amazon and others will build a newer, better version of this kind of technology. But what it does is it takes a PillPack, it makes it smart, so I can know if I opened the tab to take the medications in that pill box. And based on that, I can actually enter into the home base that's next to it in that image there and enter that I took my medication. So it provides a way for me to track and promote adherence to those medications. This is, kind of early technology. I expect what we have in the future will be even better. And then lastly, a great digital experience is personalized and engaging. If we look at digital pharmacist, one of those other new market entrants, this is really a mobile app environment that any organization with a pharmacy can white label. It enables things like seamless refills, refill reminders, medication reminders, a true retail experience with coupons and a customized shopping experience for my non-prescription items. If we think about how we can start to connect that, what's a way to simplify what patients are doing today, picking on that example at the beginning from PillPack, using IoT to better track and monitor adherence and engagement, the example from PillDrill, and then connecting it all to a mobile app environment becomes a great example of what we could start to do in the future. But this is a big transition, and each transition requires the people, the process, and the technology changes to support it. We know that market forces have really tipped the scales. We have new competition in this space with the likes of Amazon and all of these new market entrants that we see exploding, and new relationships, new partnerships. We know that Congress has failed to come up with a replacement strategy or even revision strategy for the regulatory environment. So there will be some continued uncertainty there that will force organizations to act. And then lastly, the cost pressure is substantial. And we expect that those three market forces will continue to push organizations forward. Amazon and others are going to force innovation. They're going to bring new competition, and incumbents will react and either fast follow or lead in innovation themselves. We'll have new insights from novel devices and IoT like we talked about before, and that will allow us to better serve an increasingly empowered and informed consumer in our space. To survive, all of us as incumbents have to invest in 4 key areas. The first is customer obsession, like we talked about at the beginning. Really building an insight-driven culture to deliver exceptional customer experiences. Installing digital platforms so that we can really start to engage with cloud-based technologies and connect and build great digital experiences becomes essential. We need to invest in consumer data privacy and prioritize HIPAA over personalization. We went through that great Dexcom example. It's possible to build highly private but highly personalized digital experiences. We just have to have that at the forefront of our mind when we're building these things. And across all three of those domains, we have to infuse a culture of innovation where we give our organizations guardrails so that we can innovate and fail faster and try new things and learn and provide the air cover so that our staff is willing to take on that risk. Our future will look very different. Imagine a world where our healthcare purchases were as easy as Apple Pay at the grocery store. Revenue cycle is one of the things that is most likely to transform in early transformation efforts. It's likely to be automated, and it's a great, great opportunity to improve efficiency in this space, not just for organizations, but also for the consumers. The virtual assistant space will continue to explode, and the things that we'll be able to do in the home with virtual assistants in compliant ways will range from everything from refilling prescriptions and tracking compliance to scheduling appointments to getting first aid instructions or asking basic questions about either the medications I'm taking or my condition. All of those things are going to be possible with our virtual assistants in the home. And partnerships are going to continue to evolve. There's going to be more new market entrants. There will be a convergence of organizations in the space breaking down today's silos. So imagine a world where our partnerships look like Amazon plus Whole Foods plus us or our competitors. Ask yourselves if you're ready for the Amazon effect because it's coming. Fast followers and leaders have a great opportunity to really establish and secure our future in healthcare, and it's an exciting time. But as Clayton Christensen says, disruptive innovation can hurt if you're not the one doing the disrupting. So I hope you get excited as you think about moving forward. And I want to thank you for your time today.
Thanks, Kate. This is Andy Ahrens. I wanted to thank you again for your willingness to be with us today and share that insight. I think Kate's points about the challenge of friction in different relationships with customers is a critical one. At NCT Data, we've started to look at this for some of our Medicare Advantage customers with health plans. We're now working across, we did a study of about 50 different plans that we'd like to share with you. Some of them are our customers, some are not. We're going to show you how we started to look at what we were trying to do. We wanted to assess the customer experience for Medicare Advantage enrollment across 50 plans to kind of see how well they did in that enrollment process. We picked a persona from the baby boomers that are representing a generation born between 1946 and 1964 that are active, highly educated, and early adopters of technology. And the process we looked at was going through and checking their Medicare eligibility, reviewing Medicare plan information from that health insurer, shopping for the Medicare plans, and then actually enrolling in Medicare. And we did all this online so we could actually compare apples to apples across the different plans. So please note that we didn't call into plans and we didn't actually complete the transaction, but we went all the way up to the point of enrollment. When we did this work, we looked at it across 5 categories. Kate earlier laid out effectiveness, ease, and emotion. We think we cover those with these 5 different categories that we use in the customer friction factor assessment. First, we do engagement, where we look at how the manner in which the company interacts with the customer. Second, we look at the process. How easy is it to move through, and how easy is it for the member to know where they are in that process? We look at the technology and see if there's friction being caused by bad technology platforms or challenges there. Next, we look at knowledge, where we try to relate to the availability, accuracy, and utilization of the company's knowledge about that customer and their needs. And last of all, to kind of sum it up, the ecosystem, the measurement of organizational integration and knowledge within itself and also with third parties where they may have to pull in additional data. When we did this, then, as I said, we looked at 50 different health plans, and I want to tell you the top 3 that actually came out for us. First, Roll Tide, Alabama. Blue Cross Blue Shield of Alabama came first. Second came Blue Cross of Northeastern New York. And last came Blue Cross of Western New York. One of the things that we thought very interesting is those aren't necessarily plans from areas that we consider to be necessarily digitally savvy, but they knew really well how to put all the different pieces together for their members as they went through the process. We didn't want to call anyone's second grader ugly, so we decided not to name the rest of the plans in the study, but if you're a Blues plan and interested in kind of understanding where you stack up, we'd be delighted to share it. Some of the large commercial plans were actually down toward the laggard end for that view as we try and sum all it up. So really see some differences between the leaders and laggers in terms of how we did this. To kind of summarize what we saw as insights for people and opportunities for improvement, first of all, we saw that there was a real need to empower the customer. Nearly half of the participants provided eligibility on a single site, but means more than half actually didn't. So it was a real challenge to try and navigate the site sometimes. Second, design processes for the customers. 4 companies forced the potential customer to change channels and to complete the transaction. Stopping the process is like hanging up on the customer. And last of all, knowing the customer. 24% of the companies enabled the potential customer to control the transaction with the ability to switch the site's language content. Critical as we see a much more diverse population of seniors. But less than half of the companies provided comprehensive eligibility information and didn't really know the customers. So we see real opportunities for plans to improve their Medicare Advantage enrollment experience, and we'd be happy to share more details with the plans that we actually evaluated. With that, I want to turn it back to Erin, and again, thank Kate for her time on this presentation. Erin?
Thanks very much. I really appreciate the great information we've had here. Unfortunately, it looks like we've come to the end of our allotted time for this webcast. I'd like to thank both our speakers today, Kate and Andy. Just a great job. And I'd also like to thank our sponsor today, NTT Data, because without their support, we don't get a chance to bring you this great information. And most of all, I'd like to thank you and our audience for joining us today. We truly appreciate the fact that you make us part of your very busy day. So again, thank you for viewing our webinar. For IDG, this is Aaron Goldberg, signing off.